Hello everyone, this is Dr. Prashanth and welcome back to Epidemiology lecture series. In this lecture, we will discuss about the measures of occurrence, effect and impact. To begin with the measures of occurrence, here we quantify the occurrence of outcome of interest. Two common measures are used in epidemiology. One is prevalence, the other is incidence. Prevalence is concerned with quantifying the number of existing cases in a population at a designated time. When we use the word existing cases, here we include both old and new cases. A simple example, the number of registered leprosy patients in Rajasthan on Jan 1st, 2001. So here we are taking into consideration both the old and new cases of leprosy. Two types of prevalence based on the time factor. One is point prevalence and other is period prevalence. Point prevalence is the number of existing cases of a disease divided by total population at a point in time, whereas period prevalence is the number of existing cases of a disease divided by average population during a specific time period. This is the main difference between the point prevalence and period prevalence. So this is an example. This is an example of TB study where they screened around 500 residents. Upon screening, they found that 20 of the healthy residents were immigrants who are vaccinated for TB and so are not at risk. Another 30 residents already had existing cases of TB on Jan 1st. What was the prevalence of TB in the screened community on Jan 1st? Here they are asking exactly on Jan 1st. So the point prevalence is the number of existing cases, that is 30, which includes both old and new cases, divided by the total population 500, that is 0.06. And this is an example of period prevalence where we followed a population of 150 persons for 1 year and 25 had a disease of interest at the start of follow-up and another 15 new cases developed during the year. So here the old and new cases will be 25 plus 15. What is the period prevalence? Because they are calculating it for the year, right? A specific time period. So the period prevalence is 25 plus 15 divided by the total population, that is 150. So it's around 0.27 or 27%. What if I ask the point prevalence at the start of the follow-up? You can just comment this in the comment section. Incidence is concerned with quantifying the frequency of occurrence of new cases in a defined population arising during a given time period. So here we are exclusively talking about the new cases. This is the main difference between incidence and prevalence. A simple example. The number of new patients registered with leprosy in Rajasthan from Jan 1st, 2001 to 31st Jan 2001. So here we are talking about only new patients. There are two measures of incidence. One is incidence risk and incidence rate. The incidence risk is the proportion of new cases that occur in a population initially free of the condition during a specified period of time, or incidence risk is the number of new cases in time period divided by population at risk at start of period. A simple example, in population X, there were 6 new cases of insulin-dependent diabetes diagnosed per 100,000 of the population in the year Jan 1st to 31st Jan 2001. So here the number of new cases will be 6 upon the population which is 100,000. Okay, this is an example of incidence risk. If you can see the diagram on the left side, you can see the cases. Case A, B, C, D and E. We followed these 5 cases for a period of 10 years that you can see on the x-axis, the time period. Okay, this is an example of incidence risk. If you can see the diagram on the left side, we followed 5 cases, case A, B, C, D and E for a period of 10 years that you can see on the x-axis, the time period. The green color indicates the healthy period, whereas the red indicates the disease part. So, as per the definition, if you want to calculate incidence risk, we first need to find out the number of new cases. In this example, if you can see, the number of cases are 3 actually, like the B, D and E. They had disease, right? But if you can look at the case B didn't develop the disease during the follow-up. He was having disease from the start of the period. So we don't include B in the new cases section. So here the number of new cases will be 2. That is case D and case E divided by the population at risk who are free from the disease. So even in the population, we exclude B because B is not free from disease at the start of the follow-up, right? So the answer is 2 divided by 4, that is 0.5 or 50%. Okay, now coming to the incidence rate, which is similar to incidence risk, but instead of number of cases, we use the total person time at risk. So we will discuss about the person time at risk in the next slide. So in simple words, incidence rate is the number of new cases divided by total person time at risk. A simple example, during a follow-up survey among 350 female inmates in Vellore, Tamil Nadu, the incidence of pulmonary TB among HIV positive women was 9.92 per 100 person years. So this is the main difference. Here we can see the person years, right? Whereas in incidence risk, we see the population. What is time at risk? It is the total time that the subjects in the population spend at risk during the follow-up period. For example, we followed a particular individual from a starting date to the end of the study, and we will calculate the healthy period. If you can see the first diagram where we can see two parts, right? The healthy and the diseased part. In this case, the time at risk will be from the start of the study till the point where the individual is healthy, which I have indicated with the closed brackets. And now coming to the second diagram where the individual did not develop the disease throughout the follow-up period. So here the time at risk will be the starting from the year 1 to the end of the study. And in the third case, the person was healthy from the start till the midpoint, and after that he was lost to follow-up. So here we calculate the time at risk from the start point till the point where he left the study. So this is an example of incidence rate which is similar to incidence risk, but here we don't take the population, right? We take the person year. So let's see how to calculate the person years. As I already said, the person time at risk is the period starting from the study till where he is healthy. So if you can see the case A, you can see the green part throughout the study, right? That means the case A is free from disease from year 1 to year 10. So here the person years is 10 years because we count all the 10 years. If you come to case B, here the person is free from disease for the first 5 years, 1, 2, 3, 4 and 5. But after 5th year, he developed disease. So here the person time at risk will be 5 years. Similarly for C, it's 5, and for D it's 2, and for E it's 3 years because after 3 years, he developed disease, right? So you calculate you calculate the person time at risk for all the cases, and you look at the new cases in this case. In this case, the number of new cases are 3: case B, case D, and case E. So 3 divided by the total person time at risk. So when you count all those person years, 10 plus 5 plus 5 plus 2 plus 3, you get 25. So the answer is 0.12. So now coming to the most important concept, the relationship between incidence and prevalence. As you already know that prevalence includes both old and new cases, whereas incidence include only new cases. Prevalence is equal to incidence into duration of disease, that is P equal to I into D. A simple example, before insulin was available, few people lived for long with type 1 diabetes mellitus and the prevalence was relatively low. Insulin does not cure type 1 diabetes mellitus but enables people to live for many years and decades. That means insulin increased the duration of disease, right? With this condition leading to increased prevalence of type 1 diabetes mellitus. So a simple equation here, right? When prevalence is equal to incidence into duration, if any drug or something increases the duration of the disease, automatically the prevalence also increases. So now coming to an example for the relationship between prevalence and incidence. Prevalence of AIDS was given as P. A new treatment was introduced that prolongs the life of the patient but does not cure disease. If all other factors are kept constant, what happens to the prevalence in this case? So let's break down this. When we use the word prolongs the life, the duration of the disease is increasing, right? So incidence is set as constant in this case, as they already said all other factors are kept constant. So by just using the equation, prevalence equal to incidence into duration, incidence is constant and the duration of the disease increases. So automatically the prevalence also increases. These are some practice questions. You can just go through them and post the answers in the comment section. And now coming to the odds, it is the number of cases in a defined population and time period divided by the number of people who did not become a case in the same time period. In simple words, odds is nothing but the number of cases divided by the number of non-cases. Simple example, the odds of developing conjunctivitis in the school during a study period is 0.025. That means number of cases by number of non-cases in this case is 0.25. So this is a numerical example of odds. In a stable population of 100 school children, 20 children had at least one episode of conjunctivitis during a 1-year study period. Calculate the odds of developing conjunctivitis in school during the study period. So as we know, as per the definition, odds is the number of cases by non-cases. In this example, they gave us the number of cases, that is 20 children had at least one episode of conjunctivitis. So we substitute that 20 divided by what are the non-cases, because they gave us the total population, right? So the total population is 100 and the number of cases are 20. So you subtract 20 from 100. So 20 upon 100 minus 20, that is 0.25. Measures of effect. This is the second measure. Measures of effect are used to compare the occurrence of outcomes in different populations. In the first section, we discussed how to measure the occurrence, and here we try to compare those occurrences between two different populations. Two types of measure of effect are there. One is ratio measure and the other is difference measure. Now coming to the ratio measures are used to compare the following measures of occurrence. One is incidence risk or the risk ratio, incidence rate through rate ratio, and the third is the prevalence ratio, and fourth is the odds ratio. Let's look into all the four briefly. Risk ratio, as already said, it compares incidence risk. It compares the incidence risk of an outcome in two populations. So in simple words, risk ratio equal to incidence risk in exposed population divided by incidence risk in unexposed population. It measures the strength of association between the exposure and the outcome. Now let's look into the example of risk ratio. A study was set up to investigate whether fatal childhood accidents are more common in low-income families than in high-income families. Incidence risk per 100,000 per year of fatal childhood accident in low-income families and high-income families is given as 87.9 and 23.2 respectively. Calculate the risk ratio or RR. So they gave us the incidence risk in exposed and non-exposed. So you simply substitute that in the formula. That is, the incidence risk in exposed is 87.9 divided by incidence risk in unexposed, that is 23.2. So the answer is 3.8. Now coming to the rate ratio, here we compared the incidence rates. And what is the main difference between incidence rates and risk? Here we consider the person time at risk, right? Whereas in incidence risk we take the population. So rate ratio compares the incidence rate of an outcome in two populations, exposed and unexposed. It is the only measure that takes into account the person time at risk in each exposure group. In simple words, rate ratio equal to incidence rate in exposed population divided by incidence rate in unexposed population. A numerical example of rate ratio. A study looked at the effect of working in a gold mine on the incident rate of tuberculosis. The incident rates of TB in gold mine workers and those who never worked in a gold mine is 3 per 100 person years and 0.6 per 100 person years. Calculate the rate ratio. So here they gave us the incident rates for exposed and unexposed. You simply substitute that in the formula. So incidence rate in exposed is 3 per 100 person years divided by the incident rate in unexposed is 0.6 per 100 person years. So that is 30 by 6, that is 5. And now, then what is relative risk? Most of the times you hear the word relative risk instead of rate ratio and risk ratio. The term relative risk is used in those situations when the risk ratio and rate ratio are numerically similar. Risk ratio and rate ratio are numerically similar in those cases where the outcome of interest is rare in populations and there are very few people entering or leaving the different exposure groups. Next is odds ratio. Odds ratio compares the odds of having a particular outcome in a population exposed to a suspected risk factor with the odds in a population not exposed. This is similar to odds, but here we are taking the ratio. That's the only difference. In odds ratio, the odds of outcome in exposed individuals is divided by odds of outcome in unexposed individuals. So the measure of association which is most commonly used in case control studies, that is odds ratio. A simple example. A research was done to investigate the influence of parental smoking on the development of ear infection in childhood. So the odds of developing ear infection in children with parent who smokes is given as 0.39 and the odds of developing ear infection in children without parents who smokes is 0.21. So here we know the both odds, right? You simply divide them, that is 0.39 divided by 0.21. So here the odds ratio is 1.86. And now coming to the fourth concept, that is prevalence ratio. It is used in health service planning to compare the burden of a condition in different groups. In simple words, prevalence ratio is nothing but prevalence in population A or prevalence in population B. Here the prevalence means the prevalence of outcome of interest or the prevalence of any disease, particular disease. It is simply a measure of effect, the prevalence ratio. It's neither an estimate of the magnitude of effect of the exposure on prevalence nor a measure of the strength of the association between the exposure and the outcome. So this is the numerical example for prevalence ratio. District A and District B are having same population size. But in District A is spending 50% more money on treating patients with HIV than District B. The prevalence rate of HIV infection in these two districts is given as follows. Prevalence in District A is 0.2%, whereas the prevalence in District B is 0.1%. Calculate the prevalence ratio. So simply we divide the prevalence in District A divided by prevalence in District B, that is 0.2 divided by 0.1. So here the prevalence ratio is 2. Interpretation of ratio measures. So this is a very important concept because now we know how to calculate these ratios, but it's very important to interpret them, right? So coming to the ratio measure, first one, relative risk or the rate ratio or the risk rate. When RR is equal to 1, the risk in exposed and unexposed persons is the same. When RR is more than 1, the risk in exposed persons is greater than the risk in unexposed. When relative risk is less than 1, risk in exposed persons is less than the risk in unexposed. Now coming to the odds ratio, which is similar. When OR is equal to 1, the exposure does not affect odds of outcome. When odds ratio is more than 1, exposure associated with higher odds of outcome. When odds ratio is less than 1, exposure associated with lower odds of outcome. So this is a practice question for OR, risk ratio and rate ratio. Please go through this and post the answer in the comment section. Okay, after ratio measures, the other type of measure is the difference measures, right? So it's an alternative way to compare the occurrence of an outcome in a group that has been exposed to a particular factor with the occurrence in a group that has not been exposed. So basically here we directly see the difference. So that is called absolute difference. That is the occurrence of outcome of interest in exposed minus occurrence of outcome of interest in unexposed. This is called absolute difference. But there are two types of differences in difference measures. One is risk difference, the other is the rate difference. Risk difference is nothing but the incidence risk in exposed minus incidence risk in unexposed. Rate difference is the incidence rate in exposed minus incidence rate in unexposed. Risk difference compares the incidence risk of an outcome in two populations, whereas the rate difference compares the incidence rate of outcome in two populations. That's the main difference. Now let's look into the numerical examples for both the measures, that is the risk difference and the rate difference. In example 1, mortality risk from diarrhea among babies under 1 year old who are not breastfed is 49.6 per 1000 babies per year. And the mortality risk from diarrhea among babies under 1 year old who are breastfed is 7.4 per 1000 babies per year. So what is the risk difference here? We just directly subtract the incidence risk in exposed minus unexposed, that is 49.6 minus 7.4, that is 42.2 per 1000 babies per year is the risk difference. In example 2, that is rate difference, the incident rate of oral cancer in group who are exposed to tobacco is 22.3 per 100 person years, and the incidence rate of oral cancer in group who are not exposed to tobacco is 8.2. So what is the rate difference? So here we directly subtract the rates, right? The incident rate in exposed is 22.3 minus the incident rate in unexposed, that is 8.2. So the answer is 14.1 per 100,000 person years. And now coming to the interpretation of different measures similar to ratio measures. When the different measure is more than 0, what does it imply? It implies the incidence in the exposed group is more than the incidence in unexposed group. It also implies that difference measure estimates the excess occurrence of the outcome in the exposed group when the difference measure is more than 0. And if there is a causal relationship, this is equivalent to the number of cases in the exposed group that are caused by the exposure. And when the difference measure is less than 0, it implies the incidence in the exposed group is less than the incidence in unexposed group, or different measure estimates the reduction in occurrence of the outcome in the exposed group. And if there is a causal relationship, this is equivalent to the number of cases in the exposed group that have been prevented by the exposure. Attributable risk. So it is used when there is a causal relationship between an exposure and outcome. Attributable risk is nothing but the number of cases attributable to exposure in the exposed group, or in simple words, AR is risk in exposed minus risk in unexposed. And how does we interpret it? When attributable risk is more than 0, the number of cases that could be prevented if the exposure were removed from the exposed group, or if AR is less than 0, the number of cases that have been prevented by the exposure in the exposed group. And now coming to the attributable fraction, it's nothing but the attributable risk, but here we don't find the number of cases. Here we see the proportion. It is used when we want to know the proportion of the total disease occurrence in exposed individuals is due to exposure instead of number of cases. Instead of number of cases, if you want to know the proportion, then we use the attributable fraction. So if you can look at the formula of attributable fraction, it is nothing but the attributable risk, that is AR, divided by risk in exposed group. So we know the formula of AR. AR is nothing but attributable risk, which is equal to risk in exposed minus risk in unexposed, RE minus RU, divided by the risk in exposed. Or if you want to get the answer in terms of relative risk, or if you find relative risk in the question directly, you don't need to find the risk in exposed and unexposed, right? So you can directly use this formula, RR minus 1 divided by RR. This is also equal to attributable fraction. And it is also known as the etiologic fraction or the attributable proportion. Let's look into an example of AR and AF. Of 2000 babies born to mothers who smoked at least 15 cigarettes a day during pregnancy, 60 died within the first year of life. Of 4000 babies born to mothers who did not smoke during pregnancy, 80 died within the first year of life. Calculate attributable risk and attributable fraction. So let's start with AR, attributable risk. You know the formula, right? The risk in exposed minus risk in unexposed, RE minus RU. So the risk in exposed in this case is 60 divided by 2000 minus the risk in exposed, 80 upon 4000. So the answer is 0.01. And when you come to the formula of attributable fraction, it is nothing but the attributable risk divided by the risk in exposed. Now we know the value of AR, right, which is 0.01. So 0.01 divided by what is the risk in exposed? It's nothing but the 60 divided by 2000, that is 0.03. So the answer here is 33%. And now coming to the last measure, that is the measures of impact. If we want to know how much risk is attributable to an exposure in the entire population, then we use the measures of impact. It is similar to AR and AF, but here we use the terms population attributable risk and the population attributable fraction. And what is the main difference in this? In this measure, we considered the incidence risk in total population instead of exposed group. So population attributable risk formula will be the risk in total population minus risk in unexposed, that is RT minus RU, whereas in normal attributable risk it is RE minus RU, right? Risk in exposed minus risk in unexposed. But in PAR, population attributable risk, it's RT minus RU, where RT is risk in total population and RU is risk in unexposed group. Similarly, population attributable fraction, PAF, it is similar to attributable fraction, but here PAF equal to PAR divided by RT. That means population attributable fraction is equal to population attributable risk divided by risk in total population, that is RT. Whereas in normal attributable fraction, it's AR by RE, right? Attributable risk divided by risk in exposed population. Or in terms of relative risk, you can use an alternative formula, that is RR minus 1 into P divided by RR minus 1 multiplied by P plus 1, whereas P is the proportion of population that is exposed. So based on the question, you can use any of the formulas. Let's see an example for PAR and PAF. This is an example of study of breastfeeding and HIV infection in children born to HIV infected mothers. And the data given was risk of HIV infection for children who were breastfed was 0.28. Risk for children who are not breastfed was 0.15. And the risk for all children in the study was 0.26. That is the risk of total population. So now calculate the population attributable risk and population attributable fraction. So first look into the population attributable risk, that is the risk in total population minus risk in unexposed. And what was the risk in total population? It was given as 0.26. So you subtract 0.26 from the risk in exposed, that is 0.15. So the answer is 0.11. So now you know the PAR, that is the population attributable risk. So PAF will be population attributable risk divided by the risk in total population. So the answer will be PAR, that is 0.11 divided by the risk in total population is 0.26. So the answer is 0.423. Thank you.